I was a physical therapist before I went to med school. I understood the importance of motion. Motion is essential. Motion is the vital aspect of our daily lives that keeps us functional, keeps us doing the things we love to do. In the last 15 years, a lot of research has come out that has really indicated to the medical world that disc replacements are a very good option, and they're very good options for a wider variety of patients that we suspected. So we started doing disc replacements early on in my residency, but the indications and the availability has widened considerably. I started using Mobi-C roughly about 7 or 8 years ago. We had done a small subset of patients and compared them to our other patients. First of all, the Mobi-C has excellent accessibility, meaning when you do a Mobi-C, the patient might have some bone spurs because of some arthritis. So the accessibility of patients who can get a Mobi-C procedure is far wider than for other procedures. We find that it's really the procedure of choice for just about everyone who is in the category of patients who are good candidates for a disc replacement surgery. The motion is excellent. They have very few restrictions, and there's very few areas that we worry about with the Mobi-C. It is a hallmark procedure. The surgical technique is simple. It's straightforward. It's most natural. You remove the disc, you size the disc, and you put the new spacer in. The one thing I love about the Mobi-C is that it comes in so many sizes, so we can tailor make it for just about every patient's size and shape that we have. And when the Mobi-C, when the disc replacement fits properly, that's probably its biggest advantage to gaining full range of motion and to achieving excellent outcomes for us. We've gotten great outcomes with almost every disc replacement we've done. At their first visit, they're already getting on the floor to play with their kids. They're taking their dog for a walk. You know, Mr. Jones has been able to go back to work. For me, that's the gift. That's the gift of what we do. And I think we try to do that with all of our surgeries, our fusions, our decompressions, and our disc replacements.
Common post-operative risks from surgery with the Mobi-C include pain in the neck, arm, back, shoulder, or head, and dysphagia. Full risks and contraindications can be found at cervicaldisc.com.